Hey, so this video is about hallucinations, and I'm going to talk about a few different topics. I'm going to talk about the different types of hallucinations and delusions. I'm going to talk about what disorders they're associated with, other than schizophrenia, obviously. And I'm going to talk about reality testing and how to help with hallucinations and delusions. So first of all, the first thing you should know is that hallucinations are sensory confusion, as far as like seeing things, hearing things, and then delusions are ideas or paranoia that we have, so it's like an idea. So a delusion or paranoia can be something like that you think that you're secretly Jesus, or you think that you're being pursued by the FBI and they're after you. And with both hallucinations and delusions, there can be a certain amount of insight. And what I mean by that is that you can be somewhat aware that it's not real. You know what I mean? So you can be have a certain awareness that it's not real, but still be confused by it. And then there's sometimes when you have no insight and you fully believe it and you have no idea to tell if it's real or not, and you just believe that it's real. So the different types of hallucinations are audio, that's, you know, hearing voices, hearing screams, hearing anything. The next one is tactile, like feeling like if you have bugs crawling over your skin, you know, or if you feel like you have a, you know, something inside your body that's not there, that's all tactile. Then there's olfactory, which is smelling, so you can smell like rotten stench, or you can smell like, you know, gas leak, or when there's not really a gas leak. There's visual, which is the, you know, the most, it's not actually the most common type, but it's the most talked about type, where you actually see things that are not there. And that's actually more rare. The most common type of hallucination is actually audio, hearing things. But you can see things, but it's more rare to see things than to hear things. And then there's taste. So you can actually taste things in your mouth. Like if you're eating food, it can taste rotten or taste like someone's poisoning it. So you can taste poison in it. That can all be a hallucination or delusion. So delusions, on the other hand, are, like I said, ideas in your head. And there's paranoid ideation, like being paranoid about if your friend is plotting against you, or there's delusions of grandeur, where you think that you are like someone important, like you think you're Jesus, or you think you're the president, or you think that you have superpowers. There's delusions of martyrdom, which is what I had, where I thought that if I suffered, if I hurt myself, that I could save other people. But yeah, delusions of grandeur and delusions of paranoia are the most common types of delusions. And these can occur in a variety of mental illnesses. When you think of hallucinations, you typically think of schizophrenia. But schizophrenia is actually an incredibly rare disorder. Only 1 out of about 125 people have schizophrenia. And there's plenty of other disorders that have hallucinations and delusions in them as well that are not schizophrenia. So if you have hallucinations and delusions, you probably are not schizophrenic, but don't take my word, I'm not a doctor, but you might have something else going on. So other disorders that can be associated with are very, very deep depression. If you're in a very deep hole of depression, you may have some paranoia, you may have some hallucinations, you may not really understand reality. And that's actually called major depression with psychotic features. And that doesn't make you schizophrenic, it just means that you're so depressed that your mind is not working properly anymore. Your brain is not working properly. Also, probably the most common that I see is people that are bipolar. When they are manic, they can hallucinate. Like I know people that when they're manic, they hear the voice of God, or they think that they're an angel, or they think that they're Satan. And that's pretty common in people that are bipolar, you know, manic depressive disorder. Also, people with borderline personality disorder will hallucinate and have delusions, but only under episodes of extreme stress. So if they're very stressed out and if they're very angry and very irritated, they can have delusions and hallucinate sometimes, which has happened to me. And then people with anorexia or body image issues have some delusions about that they're too fat, or that like people are thinking they're fat, but that is not necessarily a different criteria, because that kind of falls under the category of the eating disorder anyway. But if it's too extreme, then it can be labeled as a delusion as well. So how to help? The biggest thing that they say is reality testing. And reality testing does require some amount of insight, so you have to be somewhat aware that you are hallucinating or having delusions. But what you can do, the best thing to do is call a friend, call your therapist and say, hey, is it true that squirrels are purple? Or something like that. You know, is it true that, you know, I think the police are after me? Is that true? And then they can tell you no, and then you kind of have to have faith in them. So you almost have to put your faith in someone else and say, you know what? I understand that I'm not fully in my right mind right now, and so I'm putting my trust in someone else. And that's a very powerful thing to do, you know, that you can trust someone else to kind of tell you if you're in reality or not. You know, that's a big deal. Also, you can, what I think would be a good idea is leaving notes around the house. So for instance, if you have a common delusion that you're Jesus, then you could leave notes around your house saying, like, you know, that you're not Jesus, or, you know, affirmations to help you stick in reality. And, or even your friends could write them for you, or your therapist could write them for you, and you could put them around your house. So yeah, that's what reality testing is. If you have any more questions about hallucinations or delusions, leave them below. And I'll link my video about my hallucinations and delusions right up here. And check it out. And thank you guys so much.